Okay, we have the trochlear nerve. Trochlear nerve is the nerve number 4. Okay. Okay. Innervate the superior oblique muscles. Okay. Sorry, هي تعلق معي. Okay, because it's motor neuron or motor nerve, so it goes from the trochlear nucleus within the mesencephalons. Okay, من central nervous system, من something called trochlear nucleus. Okay. Condition caused by the nerve damage. إذا حصل لنا nerve damage لهذا النيرف، حصل له مشكلة، هتؤدي إلى paralysis of the superior oblique leading to strabismus and diplopia. okay. إذا حصلت مشكلة لهذا العصب تحصل لنا strabismus and diplopia. okay. طيب this is the trochlear nerve and it goes to the superior oblique muscles, which is the function of the superior oblique is just to raise the eye and to turn it. okay. وظيفتها انه عشان كده trochlear nerve means poily. okay. poily, like it's raise the eye and gives you the movement. It's like a circle and raising. بتعطيك حركة اللي هو لفوق بحركة دائرية يعني. okay. طيب so now the eye movement or the eye muscles, 4 of the muscles is supplied by oculomotor. okay. Number 3. okay. We have something called superior oblique, okay, which is supplied by number 4. Also we have another muscles. okay. These muscles is the lateral rectus. okay. This muscles is supplied by the 6th cranial nerve, which is called abducent. okay. The lateral rectus بتغذيها مين؟ النيرفس او الكرينيال نيرف number 6 which is called abducent.